Good afternoon or good evening, South Fulton. Thanks for each and every one of you for joining us tonight for what I think will be an informative conversation as it pertains to the vaccines that are readily available to you and other people in the state. Many questions have been asked about it, and I thought it was a better time for me to bring in a person that who leads this effort, Dr. Lynn Paxton. Dr. Paxton is a retired United States Public Health Service captain and has an extensive career with the Center for Disease Control. She recently served as the Zika coordinator for the CDC Center for Global Health. She was appointed the district health director for the Fulton County Board of Health on May 1st, 2020. Dr. Paxton earned her medical degree from University of California, San Francisco, and a master's of public health at the University of California, Berkeley. She completed her undergraduate work at Princeton University. Dr. Paxton, I gotta get somebody to write me a short bio like that. I mean, it's right to the point. So, introducing Dr. Paxton.
Hi. Okay.
Yes, there she is. Thank you so much I know you've been busy. I mean, you've been on everybody's panel and all around the board and other places. I'm just so thankful that you had the opportunity to be with us tonight to talk about this issue.
Thank you for inviting me.
Yeah, we have several questions that we've gathered from communities all around. Dr. Paxton, I guess people always come up to you and other elected officials and say, when do I get my vaccine? What do I have to do? You know, they think are pertinent questions. So I have questions here that we have that we want to talk, that we're going to run by you. So you can tell us a little bit about the what may be the answers to some of these questions. Can you before we begin, you talk a little bit about the updates on the vaccine process and what's happening as of right now?
Okay, certainly. Well, we received our first doses of vaccine around the 17th of December. And ever since then, we've been doing our level best to get them out to everyone. The process is that the state, the Department of Public Health, has a plan of phases in which, and as to which people will be first offered the vaccine. And our first tier, which was called Tier 1A, was originally supposed to be healthcare workers, because we have to protect the people who are taking care of us, protecting us. And then also residents and staff of long-term care facilities, because those are the people who had the highest more death rates throughout this epidemic. So it was always planned that these would be the first people that would be targeted for the vaccine. On New Year's Eve, the governor, I should say, and then the next tiers we were going to progress through them. The next tier would include people over the age of 65, first responders like police, firemen, and the like. Then we'd move into essential workers, to the schools, and so on and so forth. People in jail. So it was it's a very planned progression of how we'll get to everyone. Because eventually, we want everyone in the county, actually in the United States, to be vaccinated, because these vaccines are incredibly effective and also incredibly safe. So here in Fulton, we had that plan and we were starting in on it. And then the governor on the 31st of December announced that all people over the age of 65 would be moved up into this tier. Because they, of course, have higher rates of COVID infection and disease, and that's good because, of course, people they are at higher risk. But it did force all of the public health system to basically change gears very quickly to expand the vaccinations very, very quickly. And that is kind of and so it overloaded the system, to be honest. And that's one of the reasons why people have been having trouble, not just in Fulton County, but literally over the entire state of getting, through to, to actually make appointments and the like. So all of the counties are really working very diligently on trying to overcome that. Because the other issue, which I think many people are aware of, is that nationwide, there is a relative shortage of vaccines. There are simply not enough vaccines at this moment in time to meet the demand. So that's another reason why it's hard to get an appointment, because all of the counties, and especially Fulton, we push out as soon as we get the vaccine and we have the personnel to put it out, we make appointments available, and they are snapped up like that. So that's the reason when people ask, well, why can't I get through? Why can't I get an appointment? That is the basic reason. But we are really working very hard to improve our appointment system. So we have, just today, there was a problem last week in which it was allowing overbookings, and it really overloaded us. But they have just revamped the appointment system, and they tested it today. And I believe they just did a test run, which worked very, very well. They opened up 500 appointments. And again, they were snapped up very quickly. So I think we're going to get that under control. And the other thing is for people who don't use the internet, who may not be particularly tech savvy, we still have our call center, and we are expanding that. We're putting in more lines, we're putting in more people so that anyone can call the call center and can make an appointment that way. Similar to the way we do COVID testing. So that's sort of an overview of where we are with the vaccinations in Fulton County.
And thank you so much for that. I know you have a couple of people with you. If you want to just introduce them.
No, I'm all by myself.
You're by yourself? Okay.
Yes, I'm at home.
Hey, well, let's get right into the first question, Dr. Paxton.
Yeah.
And that is, how does the new vaccine work?
Mm-hmm. Well, there's two vaccines. One is you'll hear referred to as the Pfizer vaccine, and one is the Moderna vaccine. That's the name of the companies that are developed and marketing them. They are both, however, the same type of vaccine. They are called an mRNA vaccine. And mRNA refers to, that's the component people have heard of DNA. RNA is like sort of DNA, and to be very, very simplistic. And this is a vaccine which was designed to just mimic one small portion of the COVID virus. Okay, and so with this vaccine, it's injected into the person, and then the person then develops antibodies to this particular component of the virus. And that's the component that the virus uses to enter into your cells and then infect it and cause problems and eventually cause the disease. So the vaccine causes your body to then make antibodies to this. And so if you are then exposed to the actual virus, then when the virus enters your body, your body's already primed with antibodies to that one particular part of the virus cell, and it can prevent it from entering your cells. And that's basically the way it works. And in the studies, both of the vaccines were highly effective. I mean, they're 95%, which is amazing. We were all hoping before the trials finished, we would have been thrilled with a vaccine that was like 60% effective. So to have something that's 95% effective, it felt like, oh, somebody's finally, looking down on us and giving us a break. They also do have side effects, as most things do, but they're mild. I mean, and for most people, like for example, when I got my dose, the only side effect I had was I had some discomfort at the injection site, which is the same thing that happens to me every time I get my flu vaccine. So for like a night or two, I can't sleep on that arm. But that's about it. Other people have they might say that they have feel a little bit like they have the flu, like they might have a little fever, or they might feel a little tired or a little bit achy. But in general, those side effects are very short-lived. Generally after a day, they're gone. Usually treat it with some Tylenol, and people are fine. And then they get the second dose. The second dose, these are both 2-dose vaccines. With the Pfizer vaccine, you get your second dose 21 days after your first dose. And with the Moderna vaccine, you get your second dose 28 days afterwards. And so it's very much the same process. And sometimes more people would report that they feel a little bit more flu-y at the time when they get the second dose. But I remind people that actually that kind of is showing that your body, it's working the way it's supposed to, because it's basically, reacting as if you had been exposed to COVID, and it's building up those antibodies. And so I tell people, if you happen to get, and most people don't, less than 10% of people even say that they even had that kind of flu-like reaction. But if they do, I just remind them, I said, well, that shows that your body it's actually doing its job. The vaccine is actually working to prepare you to be able to fight off COVID. So that's kind of a very brief overview of that.
Thank you. Next question has to do, did the speed of the vaccine development compromise safety?
It did not. And one reason why, let me do a little bit of explanation in that. I don't know, most people on this call will not be familiar with this, but several years ago, there were epidemics of a similar coronavirus called MERS, and these epidemics, one was called SARS. It caused some deaths primarily in Asia. Then there was another variant of this coronavirus, which caused in the Mediterranean. It was called MERS, and it also caused some deaths and all that. However, so at that time, the research community started working on the vaccine process for these two diseases, SARS and MERS. And these viruses are very similar to the COVID-19 virus. However, those epidemics were pretty quickly controlled. And so there was never a need to do large scale vaccinations against them. However, because when COVID hit and it became quite clear that this was going to be a worldwide pandemic affecting literally millions and millions of people, the one advantage we had is that the research community had already started working on these vaccines. And they were very quickly able to turn to developing a vaccine for COVID. And they did it very quickly because it actually, from the laboratory sides, it's actually not that difficult to construct an mRNA vaccine, okay? In contrast to some other types of vaccines like live polio virus and all that have to be grown up in culture. And so you have to wait and culture it in the lab and all that. You can basically construct this vaccine using a computer and the components. It's like laser printing a vaccine for reason. So it's actually relatively easy. So the developers of the vaccine were able to quickly create it. And then the second thing that led to this being very quickly tested was that the governments decided that they were going to throw literally billions of dollars at this to facilitate the testing process. So the normal length of time that it takes to do a vaccine can often take years. And that's because you do it in stages. You do a small, what we call phase 1 and phase 2 safety trials, just to make sure that these drugs are safe. You're not looking to see whether they're effective, just to make sure they're safe. And then generally in the normal course of things, you do these and then they stop, they analyze the data, then they go on several months later, they progress to the next phase and all that. And the reason why companies do that is because these are expensive and they really don't want to, go too far and possibly lose money, if it doesn't work out. And then you go into what they call the efficacy trial, which is much larger. And those are the huge trials in which you see whether or not it actually works, okay? Now, what was different about this vaccine effort is because billions of dollars were put into this to allow the drug companies to do these tests much quicker. I mean, in terms of the phasing, not having to wait to, several months to get more money to then, be able to progress on to the next one. So, but all of the actual tests, all the actual research was done exactly the way that it should be done normally. What was speeded up was sort of the interval between the trials. So what was also, I guess you can see, you can kind of call this a silver lining to a bad cloud. They were also able to in the efficacy trials, they were also able to reach a conclusion faster because COVID was kind of out of control. The reason why is that in these trials, you have an active drug group and a placebo group. Everyone's heard of what a placebo is. It's an inactive form of whatever you're testing, okay? And in order to make sure you're not fooling yourself, you do what was called a double-blind trial, in which some of the contestants usually half the participants get the live vaccine, get the vaccine, the other half get the placebo. And then because you don't know who got which, the people don't know, the participants don't know, the scientists don't know, because it has to be blinded. So you don't necessarily, convince yourself of something without, it being true. You decide beforehand how many infections you need to see before you can take a look at the data to see whether or not how it falls out. So before you even start the trial, you say, well, we will be able to, the statisticians do all this, and they figure out we need to see, like, let's say 200 infections to be able then to tell us whether or not this works. Now, what I was referring to as the silver lining to this dark cloud is when with COVID sort of being out of control, they saw more infections very quickly. And so they reached that endpoint quickly, in which they could then have an independent data safety monitoring board looks at the data. And when they looked at the data, that is when they discovered that this vaccine had protected 95% of the people that got it. And that in terms of cases of severe disease, in general, almost all of the cases of severe disease were in the people who got the placebo, who did not get the vaccine. So it appears that this vaccine prevents both from somebody from getting the infection, and should they get the infection, it prevents them from getting severe disease. Okay. So that is it. And in my past life, I don't think it was in the little bio you mentioned, but I was a researcher at CDC. So I'm very familiar with how trials are done. And then I also was chaired consulting advisory committees for the FDA. So I also know how the FDA goes through its approval process. And so I know, looking at these trials, that they were done exactly the way that they should have been done. There were no corners cut at all. And because I had that confidence, I was the first person at the Board of Health to get vaccinated. I said, I want this, and I want everyone to see that I know that this is that I'm confident in this vaccine. So I was vaccinated on the very first day we started having it. We started the thing now.
That's good. Yeah. I have a very short question, but a very important one to most people. And the question is the vaccine safe? It
is very safe. At this point, we're giving out, everyone worldwide is giving out more and more doses every day. And so I believe that probably as of today, at least 2 million doses have been given out. And there have been no deaths at all, of course, with this vaccine, which is very important, because I always remind people that they have to weigh the risk of getting COVID. During the same time that, we have 3,000 or more Americans dying every day of COVID. And so they have to remember that the risk of getting COVID is very high. This vaccine is safe. It is very safe. And there have been, as I said, most of the side effects that are experienced by people are mild, as I said before, when we first started. The other thing that often comes up, so I'll just anticipate it because I know somebody's going to ask this, is is the research, was it done ethically? Okay, that was a question that comes up. A lot of people, particularly in our community, in the African American community, have a very deep distrust of the medical community because of things like Tuskegee. So for those of you who, most people are aware of this, but there was a horrible, horrible human rights violation that occurred last century in which Black men who were infected with syphilis were deliberately not given treatment for not just for months, but for decades, to see how syphilis progressed. I mean, it's mind-boggling. Every time I even say the word, I can't believe that this even happened. It was a crime. It was a crime against humanity. However, as a result of this, the whole research landscape completely changed. There were protections put in place at every single point of the process. For example, you cannot do any research in humans unless at the point that you propose it, you before your institutional review board. So they look at it, is it scientifically sound? Is it ethically sound? And you have to go, if you're doing a multi-center trial, it has to go through the review board of each center, okay? Then as you're doing the trials at each phase, like the phase 1 safety study, the phase 2 safety study, the phase 3 efficacy trial, each of those has an independent data safety and monitoring board in which they're completely independent of the researchers. And they are the only ones who can look at the data unblinded during the course of the trial. And they will do that. And then they will communicate back and they will say, if they see sign, there's basically 3 things that they decide when they look at the unblinded data. They look to see if there's evidence that this is super effective, and therefore it would be unethical to continue the trial because you should stop it and just give the whatever it is you're testing to all the people in the trial. That happens very, very rarely. The other thing is that then they look to see whether it doesn't show that it's ineffective, that you can continue the trial and you'll never come to a result, or it's harmful, in which case they will stop the trial. They'll say, there's no sense in doing this. It's either harmful or whatever. That very rarely happens. Most generally, and I've been the recipient of this call as the principal investigator, the chairman of the Data Safety Monitoring Board just calls you up and they say like one word, continue. So you don't know, how you're doing, but you just know that, okay, that they say you need to gather more data. And and then at the end of the trial, the Data Safety Monitoring Board looks at this and then they tell you what the results are. And then it's got to go to the FDA. And
Right.
there it is, it is examined by all of these, all the data from the trial is looked at by the FDA. And and every step of the way, it is made sure that the participants in the trial have been protected and that the results of this research are pertinent to the population groups that it's aimed at. So, I mean, I kind of spent a little bit of time on that, but I think it's important because we're no longer in the era of Tuskegee. We are in an era in which there are so much oversight over research that it's made it safer and I think also more equitable. I can't hear you. Mm-hmm. I think you're still muted.
All right, you got me. Something came over a few minutes ago, and I think this is recent information that that's been dispensed from the news. And it says, the question wants to know, why is Georgia last on the list for moving the vaccine?
Well, the thing is, it's actually, and I've been asked that a bit too. There is a problem with that assertion. Georgia is moving, the various counties are moving the vaccine. One of the big problems we have though is that there's been a lag for us entering the vaccine. I can even say here in Fulton County, we had, I think by today we've given out 10,000 vaccines. At the beginning of this week, we'd only entered the numbers into the system of about maybe a tenth of that. So what we did is we got extra people in to actually enter all the data into the system. And we found that that's actually happening in a lot of hospitals and clinics and the like, is they're simply unfamiliar with the, with the process of entering the data. So they're now working on actually rectifying that. And in the first couple of days when they started to put this push on actually getting the results into the database, I think we already we jumped 4 places, in the ranking in terms of, getting things out. So I think that it's a combination of a couple of things. We could always do better and get more, vaccines out, but we're doing the best with the amount of vaccine we've been given. But also there was a true data entry lag there. And so the data that was put up on the websites was not exactly accurate because not all of it had actually been entered into the system.
Okay. One of the other questions too, I think it is pertinent, and I have it, they'll give it to me. And that was, we talked about the vaccine, then all of a sudden we're hearing about these mutations. Will the vaccine that we have, will it be effective against those mutations? Yes,
all indications are that it is, because the beauty of it is that this vaccine is made to, it's targeted at one particular part of the virus that it needs to enter the cell. This new variant uses that same entry mechanism. So the vaccine is effective against it because it's targeting the same thing. The difference with this new variant is that functionally, though, it appears to be somewhat more transmissible, more easily passed from one person to another. However, it doesn't appear that it causes more severe disease, which that's a good thing. But the important thing is that the vaccine works against both variants.
I think that people would definitely want to do that. Is the vaccine effective for those under 18? Mm-hmm. Is there any adequate testing for that age group?
That testing is still ongoing. So for the moment, it is only it's currently got an approval for only to be given for those 16 and above, but those pediatric trials are ongoing right now. So soon we'll have data about its effectiveness and dosing and all that in children. And once we have that data, then we will pivot to offering it to children as well.
Do we have a choice, Dr. Paxton, as to which vaccine we want to use, Pfizer or some
Moderna?
Does the public have that choice?
No, but you don't really need it because they're both actually kind of the same vaccine. They're both an mRNA vaccine. The reason why, but they have different storage needs. So the Pfizer vaccine needs to be kept under very, very cold storage. And most places, most hospitals, most clinics do not have a freezer that's capable of going that low. So for them, the Moderna vaccine is better because it can be kept in a standard freezer, okay? But that's just a component, not of the actual active part of the vaccine. That's a component of the things that the vaccine is sort of wrapped in. Okay, so that's one reason why. So you're not going to go to a place and say, well, I want the Pfizer vaccine, because they might say, well, we don't have the Pfizer vaccine. We don't have that freezer. So, you take the Moderna, but they're both equally effective. They act exactly the same to the person. So you won't tell a difference as a recipient as to whether you got the Pfizer or the Moderna. They're exactly the same.
Okay, another question from a community person says, what is the vaccination plan for smaller private long-term facilities? Examples, ones with less than 30 beds.
Yeah, well, as this person probably is aware, there was an arrangement made from the federal government, for the larger long-term care facilities in which the CVS and Walgreens would be going out and vaccinating them. But for the smaller ones, that they don't fall under that arrangement. So basically, it's falling to at the moment to the Board of Health to do that. So we are the primary people who are working with the smaller care facilities. We probably won't be the only ones for a long time, for a while, because eventually, as more vaccine becomes available, it's being made available to a lot more like pharmacies and the like. And so there will be a lot more options for both the long-term care facilities and for just the general public to go elsewhere. So they won't be completely dependent just on the health department or on the large hospital systems.
Good. One of our senior writes this: I will be 81 years old in March. There are only 3 locations for administering the vaccine, and are all downtown and on the north side of Atlanta. Most seniors from the south side are not comfortable with driving through Atlanta traffic. I feel as if we're being disenfranchised. It is almost as if we were being denied access to the vaccine. You cannot talk to anyone to get an appointment. As I type this message, I've been on hold for 1 hour and I'm ready to give up.
Well, again, so that, yes, unfortunately, they experienced the problem that I started talking about at the beginning. But in terms of access, we do have that site in the South at the Aviation Center,
Yes.
which is both very, it's very accessible for people who have mobility issues, and eventually, we hope that we'll be able to make it as well into sort of a drive-through place. At the moment, people need to understand that this is a huge operation, and it takes a lot of people and a lot of staff to get it done. And if you want to vaccinate a large number of people in a short period of time, the best way to do it is at one of these larger centers. So that's what we're concentrating on right at this moment. But it has always been our plan that we will move to utilizing as well our mobile units, for example, the same mobile units that many of you have seen in your communities to do testing. We will be converting some of those to be doing COVID vaccination, and then going out to various communities in which to do that. So that is definitely going to be our plan. The other thing is, as I was mentioning, is that we're not the only game in town for getting vaccinated. So I'm always encouraging people who are already have a primary care, healthcare giver. They should check with their provider, because many of the larger systems like Grady, Piedmont, Emory, they are receiving allocations of vaccine that are separate. We have nothing to do with it. They go directly to them, and most of them concentrated first on making sure that they vaccinated their own staff. And now that they've done that, they are now starting to vaccinate their patients. And so I tell everyone that if you have a healthcare provider and you should talk to him or her and see, because it could very well be, particularly if they're a large group, like a Kaiser and all that, they might have their own vaccine. And so that you could get vaccinated there, okay? But if you don't have if that is not an option for someone, there are other places. There are, as I believe, the best thing that I advise people to do is to go to the Georgia Department of Public Health website, and they have a page there which is called the Vaccine Locator. And you can click on whichever county you're in, just type in whatever county you're in, and it will tell you what entities in that county are offering vaccinations to the general public. And so that's always a place to go and to check as well. So again, then of course there's the county health departments, there's us. So I just want to make it clear to people that there are various options that are available right now. And the last thing is, I want to assure everyone that this problem with vaccine supply will slowly go away, because it's always been a plan that the vaccine manufacturers were going to ramp up that. And now we have a new administration coming in, which has pledged that they're going to use the force of the federal government to increase production of vaccine. So I think that in the coming short months, weeks to months, or months, I'd say, because the new administration doesn't come in until the 20th. But we will start seeing greater vaccine supplies. And so this issue of not being able to get appointments because there's not enough vaccine, that will go away.
Well, Dr. Paxton, we've been using Wolf Creek over here for a long time for testing.
Mm-hmm.
Talking with the the county manager and the chairman, and we're trying to get together to make to make Wolf Creek possibly a site for vaccination, which brings it closer to people.
Yeah, well. Mm-hmm.
You're looking at good luck with that. Huh?
Well, no, the thing is, when we choose a vaccination site, vaccination is a little bit different at the moment from testing. And so we have to have like sort of different considerations because we're not doing yet drive vaccinations. So we have to have a place where people can get out of their car, get to easily, can be socially distanced while we get the vaccination, while we do the vaccination. So the considerations are somewhat different for what's currently a good testing site and what's a good vaccination site. But we're always looking for, we're always thinking ahead. When we get to the phase when we're doing smaller events and sending out mobile units, then we'll be able to also expand to perhaps smaller places to do these.
Okay. Question is, can you get sick from the vaccine? And
you mean, can you get COVID from the vaccine?
It just says, can you get sick from the vaccine? I'm assuming with anything.
Okay, well,
I guess the question would be, will the vaccine make you sick, I guess?
Okay, I think if they mean, could you get side effects? We've already talked about that. Yes, we do. There are mild side effects associated with it. But I think if they're asking the question is, can the vaccine give you COVID? No, it's absolutely impossible. The reason being because the vaccine doesn't contain the whole virus. All it contains is something that is targeting one part of the virus. So it's actually physically, it is literally impossible for the vaccine to give anyone COVID. It's not a live virus.
Okay. Why are type 2 diabetes a priority over type 1 diabetes?
I don't know that. I'm not exactly, I don't, because basically I think both of those fall into the comorbidity category. So, we don't look upon it any differently about whether or not someone has type 1 or type 2 diabetes. In fact, in general, most people with type 2 diabetes tend to be older, which already puts them into a higher risk group. So, that might be what that person is referring to.
And of course, today, I think it was, if I'm mistaken, you correct me, Dr. Paxton, I think it was Johnson & Johnson that talked about the one-shot vaccine. And the question is, what is the difference between the single shot and the two-shot vaccine? Which is more effective?
Well, the one-shot vaccine hasn't been approved yet, so I haven't seen the data yet, so I cannot comment on that. But obviously, we would be thrilled at having as I understand it, it's a different construction of a vaccine. It's a different type of vaccine. It's not the mRNA. And we're thrilled if it turns out to be as effective as the mRNA vaccines, then having it only be one dose is obviously better than having to come back for 2 doses.
Right.
Because, just for logistics. So everyone is eagerly looking to see how it performs in the trials, and I hope it performs well, because the more options we have, the more effective vaccines we have out there, the more that we can vaccinate people and get to protection much earlier.
Well, you can understand with the media out there, they're putting things all out, and those kinds of questions always arise.
Mm-hmm.
If I get vaccinated, can I return to my normal activities without precautions?
No, you may not. That's a pretty easy one. Number one is because not everyone's been vaccinated yet and all that. But even I've been vaccinated. I've got my second shot. I'm probably at my 95% effectiveness, that level already. But the thing we do not know from the research is we don't know whether or not a person who's been vaccinated could still harbor the virus, could be a carrier of the virus. And so they might not be sick, they might not get sick because they got the vaccine, but they could still be carrying the virus and they could still pass it on to someone else. And then the other thing, which should be kind of obvious just by math, is that if something is 95% effective, that already means that there's 5% of people for whom it's not effective or it doesn't work as well. And so you don't know if you're most likely going to be in the 95% group because it's a larger group, but you might be in the 5% group. So so for two things, you need to keep doing all the things we already know works. You need to wear your mask when you're out in public. You need to keep your distance. You need to wash your hands. And the reason is because you might be in that small percentage of people who don't get as much protection from the vaccine. And two, you might very well have full protection from the vaccine, so you're not going to get sick, but you've still got the virus, so you could pass it on to somebody else.
Oh, okay, yeah.
So you got it. So you will not see me outside the house without my mask.
Well, another question is, when do you feel we have safe control of COVID and we're able to return to somewhat of a normal life?
Well, I would tell everybody here who's listening to this has their part to play with this. We will get to the way that we can wipe out COVID is by reducing transmission. And how do we do that? You do all the prevention things that I just talked about, and you get vaccinated. And for us to reach what we call herd immunity, in which enough people are resistant to an infection because they've been vaccinated, we're talking like about getting 75 to 80% of the population vaccinated. So if people will do their part and wear your mask and do all the prevention stuff and get vaccinated when it's your turn, then we could be looking this time next year, we might be looking at COVID as being in our rearview mirror. Like, remember those bad times when we couldn't get together with our family members, or people were dying every day from this. It might be a memory by then, but only if everybody takes this seriously and gets vaccinated and continues to wear their mask and socially distance.
Dr. Paxton, we've had an area in our cities where, especially where we do a lot of entertainment, and we've had to be very, very hard on the fact that people were overcrowded in the nightclubs and things that and they simply say, so now we got them, we kind of got a handle on it, we got them social distancing, and the question always remains, well, how can I go in a nightclub or a restaurant with a mask on and eat dinner or have a drink?
Sometimes you got to make sacrifices. I don't go to a nightclub now, because I know what you mean. Music's loud. If you want to talk to somebody, you got to get close to them. You got to take your mask off because they can't hear you. Sometimes you have to make some short-term sacrifices for long-term gain. And so that's the way I look at it too. I don't go to indoor restaurants. I eat outside at restaurants because I measure what is my risk at a particular time. So if people will buckle down and take, again, the short-term pain, we can have long-term gain because we can control COVID and make this no longer a problem. But if people continue to go out and not wear a mask and not get vaccinated, then they can't complain about the fact that COVID isn't controlled because they haven't done what they need to do to help us all control it. So, I just think, don't complain, take action.
And we have to do that, Dr. Paxton. My position is we you can't do profits over people. We're out here trying to make it safe for everybody, and a problem for us, everybody. They're small businesses. You're hurting us. We make the money we used to. And once again, everybody has to sacrifice to that degree. Question is, once you get COVID, can you get it again?
Unfortunately, yes, you can. We do know that. There have been some cases of people who have a documented case of COVID and then several months later got it again. Very few, admittedly, very few, but it shows that it can happen. And so what we do know is that immediately after someone's been infected with COVID, they do have antibodies to the COVID virus, but they apparently don't seem to last very long, and they're not always 100%. They're not always 100% effective. So the next question that often comes up then is people ask, well, if I've had COVID, should I get vaccinated? And we say, absolutely yes. The vaccine is more effective than getting a natural infection at preventing, further infections. So if you've had COVID, we just simply say, well, wait until if you're having an acute case of COVID, you're feverish or whatever, we say wait until you're better and then go get vaccinated. So yes, even if you've had COVID, you should get vaccinated.
So you're saying if I have COVID, mild case, and I get vaccinated, it's more effective?
No, I'm saying if you've had COVID, we wait until you're recovered. I mean, I don't want to see you getting out of your hospital bed with a fever and coming in to get vaccinated. No. Just wait until you're over the COVID. And then when you're over it, then you should be getting vaccinated just like everyone else.
Okay. All right. Next question. I have gone to the vaccine locator several times, and none of the locations have vaccines available.
Well, that's the problem. I mean, again, as I've mentioned over and over again, we are unfortunate in a situation when there's not enough vaccine to meet the demand. So, but every week, every month, more and more, I think groups will be added to that list as more vaccine becomes available. So we just have to tell people to be patient and to keep checking back.
I think maybe you alluded to this question, but I'm asking anyway since they called it in. Can someone who was vaccinated become a carrier even though they did not get sick?
That's what we're worried about. So yes, that's why I still wear my mask. We don't know. You could very well be a carrier even though you're not sick. So that's why you need to keep wearing your mask so you can protect others.
Once again, we talk about washing our hands and putting our mask. People don't understand why are we washing our hands?
Well, to be honest, the major route of transmission for COVID is respiratory. It's what's in the air, breathing on someone, being too close to someone, coughing on them, that sort of thing. That's the major route. And so in fact, there's a theoretical thought possibility. I said purely theoretical that, okay, let's say that somebody sneezed on this can of water that I've got in my hand, and I have to pick it up right after that, and then I touch my face. You can theoretically pass the virus that way. However, that by no means accounts for most of the cases. And so I would say, clearly the hierarchy of prevention methods is wear a mask, socially distance, and then, the washing your hands in case you got some virus on your hands. You don't want to transfer it to your mucous membranes and all that. But clearly, mask and the social distancing, those are the most important things.
Okay. This question says, I know the vaccines themselves are free. Will providers charge fees for administering them? And will it be covered by insurance?
Yeah, well, for example, what the Board of Health is going to do, the vaccine will always be free to the recipient, okay? They will never have to pay anything. What we are looking to do, though, for anybody who has insurance, we can charge a small administration fee to the insurance company. It's small, like maybe $20, but it helps us a lot. We're a public health agency and we're chronically underfunded because when you're not in a pandemic, people forget about you and they cut your budgets. And so anyway, so that's the way it would work, is that somebody might ask you for your insurance card so that they can recoup some of that money from the insurance company. But it doesn't matter if you don't have insurance, if you don't have money, you still get a vaccine. Nobody is refused vaccination for any reason.
I've heard about a few strains of viruses. How does it compare with the current viruses? Will the vaccine protect against the new version? I think you've answered.
We already answered that. Yes.
Yeah. I think they keep calling in, Doc. Let me get this. All right. Is there any updates on how long the virus can live on hard surfaces?
Yeah, I mean, it doesn't live very long, on surfaces. So I don't know. I don't know. I don't have right in front of me, like, the actual studies, but yeah, it doesn't live very long. That, as I said, by far the most prevalent way of transmission is air, and aerosolization, droplets. It's carried, it's airborne rather than, being on surfaces.
Hmm. Let's talk a little bit about schools, Dr. Paxton.
Mhm.
Very educational school boards or whatever doing different things in terms of face-to-face learning again.
Mhm.
Two questions. One, are they communicating with you guys? And what do you feel is the safe method to continue learning in our schools?
Well, yes, we have a task force that's been working with the Atlanta public school system and the Fulton County school system basically since the beginning of the epidemic. So we've been working them all hand in hand throughout. What is important is whether, if you're a parent and you're trying to decide whether or not to let your child go to school, you need to you have to take a couple of things into consideration. You have to look and see, is that school capable of doing all the prevention things that are needed? Like, do teachers and students, are they able to wear masks? Are they able to maintain the proper distancing? And, so as a parent, I would look at that. And if I were to see a situation where they could not do that, and it's difficult to do, because if you say you've got to have 6 feet of distance between people, that automatically means that a classroom that was already full might have already been full. You might need 3 classrooms to keep the same number of people in them. And a lot of places don't have that capability of maintaining social distance. So, and then I advise people, they have to also think, what's going on in the community? If there's a lot of transmission going on in the community, then there's probably going to be transmission in the school too. It's an individual decision, I think, on the part of each school system as to whether or not they can, one, do the proper social distancing and prevention methods. And then they also look at what's going on in the community. And so what is the risk that there's going to be lots of cases, in the schools if they're open for in-person learning. So we don't make that determination at the Board of Health. That is up to the school system. We just provide them with all the information, all the data we have, like what are the community levels of COVID. We provide them with help on deciding, what are the prevention methods that they can do, helping them, figure out like how far apart should students, sit. Should there be band practice where they're singing unmasked? Short answer to that is no. Singing actually projects a lot of virus particles into the air if you infected. So we say no. If you don't need to have singing choir, we'd say don't do it. Wait until the pandemic is over. So that's sort of what it is. We work hand in hand with them, but it is ultimately their decision as to whether or not they will be open for in-person learning or not.
Dr. Paxton, we always talk about our kids when we start school, but one of our greatest heroes in our community is our teachers.
Mm-hmm.
Have you seen any plan from any school board activity that says that here's what, if you're a teacher in our system, that you're going to be tested on this date or whatever the case may be, to ensure that you're safe? Well,
what I have to remind people is you can't test your way out. You can't test your way out of this. The reason being is that, I could go and get a COVID test today and I could be positive tomorrow. Okay?
Right.
So it's not perfect. And we know it doesn't work. That's what was the strategy in the White House of testing people. And we know that became a hotbed of continuing HIV transmission because people didn't wear masks and they didn't, do social distancing. So testing is not the answer. What is more likely to be the answer is vaccinating. And so teachers and school staff are not just teachers, but custodians, people who work in the kitchens, the cafeteria, and all that. All school staff are in what's considered group 1B. So they're going to be the very next group that we go to. You know, as we're working through the healthcare workers and the first responders and the over 65s, our very next group is going to include school teachers. And so what we're already doing is we're already vaccinating like school nurses, because they're healthcare workers. And so they're already in tier 1A. And then, so the plan is that then they can in turn vaccinate, their own staff. So take some of the burden off of us, because they're trained clinicians and they can give vaccinations. So we vaccinate the school nurses and the like, and then the school nurses then vaccinate the staff.
Well, I want to thank you for in the health department for doing what you're doing for our city in terms of vaccinating our first responders. But even at that rate, Dr. Paxton, there are some first responders who refuse to be vaccinated.
Actually, can I, I'm sorry, I just read the chat and I did not realize that there's Dr. Tatanji from Emory Infectious Diseases on this.
I thought it was.
Sorry. I am so sorry. Could you unmute her so she can give so she could talk? I am so sorry.
Dr. Tatanji?
She can unmute herself.
She can unmute herself, Dr. Paxton.
Is she still on, I hope?
I don't know.
Oh, I'm gonna have to send I'm gonna have to send apologies. I don't usually read the chat while I'm talking, and I didn't realize that she was on. So I'm so sorry.
Okay. Question here is, and she can come on. Some businesses are taking precautions by taking temperatures on entrance to their facilities. A sure way of making sure a safe environment is created.
Well, I mean, obviously, if someone is having a fever, they might possibly have COVID. And so it's something you can, you don't want to let somebody in who might possibly have a fever, might have COVID. But the vast majority of transmissions are by people who are asymptomatic, meaning they don't have a fever, they don't have any symptoms. So, I think we check at the health department. Yeah, we check at the entrance. We do get a temperature on people, and if somebody has a temperature over 100.4, then we don't let them come in. But we don't kid ourselves that is the way to that we're going to be protecting against all cases of COVID, of all people with COVID that come into the building, because the vast majority have no symptoms, and yet they can still infect others.
Back to my question before I got to that, I got kind of sidetracked. But once again, the first responders, all of them are not taking or willing to take the vaccine.
Mm-hmm.
How much do you think that will defeat our purpose in terms of, because once, you get a fireman who has the vaccine, I got to shut the whole fire station down. We got to get infected and stuff. So if they're all not taking it.
Well, we're hoping that will change. I think that part of the vaccine hesitancy that we've been seeing is I have a lot of people who I'll say to them, well, why aren't you taking the vaccine? And they say, well, tell me, well, I want to see other people take it. I want to make sure that it's safe. I think, and I do believe that the more that people see that there are other people who've taken the vaccine, have been perfectly fine, that I think they'll get more of they'll have more confidence. And so I expect that in a few more months we'll probably see more people who are now reassured and we're willing to take it. In the meantime, we're also reaching out specifically and through means like this, through town halls and all that, to try and give people the information about how safe and effective these vaccines are, so that they would then feel more reassured about taking it. So it's it's going to take some work on our part, that's we just accept that. But I'm hoping that many of these people will come around and realize that taking the vaccine is the best thing for them and for their families and for their communities.
Well, I want to announce that I took me a long time.
Mm-hmm.
An appointment.
Perfect.
And the 29th?
Great.
Yeah.
For the 29th, but I got to go to Morehouse School of Medicine.
Oh, that's great. Morehouse Medicine, School of Medicine. You get have one of these Morehouse men, vaccinate you. That's great.
Now I told you about using the word Morehouse men over at the Morehouse School of Medicine. Now the Morehouse men across the street. Well,
And
Doc,
probably, and it might very well be a woman who vaccinates you anyway. So you know.
Morehouse woman, right? Yeah, but I'm looking forward. But even for me, you know, the rules don't change. You have to call and you stay on the phone, and so you finally get something. And I think that they asked us some pertinent questions about income and do we have insurance, things like that. But I'm going to be parking right in there, doctor.
That's great.
On the 29th and take my vaccine, and I guess they'll let me know when I got to come back. So Morehouse wasn't bad for me. I'm pretty familiar with that surrounding over there. So,
okay, yeah, I'm sure you would be. Yes.
I can't get lost. I think that's all. Do you have anything? I think that's all the questions that we have that has been called in, doctor. And once again, we got one more. She says, "Hold on, let me get it. Let me see if it's already been answered."
I think it's been answered.
You've answered this. It just, can you speak to the difference between the various vaccinations available on the market? I think you have.
At the moment, it's just Pfizer and Moderna. So I think we've been talking about that all evening.
Yeah. I think that's the.
There's no functional difference. They're basically they're the same.
Okay. Well, once again, let me thank you because I know you've been busy. Every time I look around, you're on a panel or something.
Yeah.
And I think forums like this to get the word out, people that the vaccine is safe and is needed if we ever going to get beyond. Our city hall has been closed for months. And people ask me every day, well, when is City Hall gonna open up? When is City Hall gonna open up? Well, my answer is when the numbers go down.
Yeah.
That's a safe answer. So when it go down, we'll resume. But we're actually delivering service from home and places like that. So, but once again, thank you so much for coming over and talk to us about this. And hopefully at some other time down the road when you get a little rest, we'll talk about the vaccine. Look at us now. Yeah, we've proven the numbers really go down.
I hope so. Okay.
Thank you.
Well, thank you very much.
And to everybody who came with you that you didn't give a chance to talk, thank you.
I'm going to have to send apologies. I don't read the chat usually, and so I didn't see that she had sent me a message. I didn't know she was going to be on the call, so I'm so sorry.
Right.
Well,
I want to thank everybody tuned in. I think that Dr. Paxton, answered a lot of questions, and some of them at the best of her knowledge, as the learner that she is, she can only be honest. And so this has been a very important time for us here in South Fulton County. And I want you to continue to watch the chat with the mayor as we talk about other things and other issues that make your quality of life the best that it can be. So I just want to thank all of y'all for viewing today. And once again, Dr. Paxton, thank you for all the work you've done. You are a hero, and you're doing great things. And we're very, very, very proud of you and the work that you're doing.
Okay. Right? Well, thank you very much. It was a pleasure to join you tonight. So
thank you so much. Thank you, everybody.